Keep yourself hydrated because it's good for your kidneys. For your kidneys to work right, they need water. When you are properly hydrated, your body has enough fluids to make pee, which is used to flush out waste. You may have noticed that when you're thirsty, your pee turns darker. Why is that? Because it's become stronger. Before starting the video, please do not forget to like, share, subscribe and press the bell icon for new interesting videos. Also, you need to drink enough water so that your blood can flow easily to your kidneys and other systems. Being severely thirsty can hurt your kidneys on its own. This is different if you have end-stage kidney failure or are on dialysis. People who are on dialysis can't get rid of enough water, so they have to limit how much water they drink. If you drink too much water, the sodium amount in your blood can drop below the normal level. This is called hyponatremia. Low amounts of sodium will let extra water into the cells, making them swell. This is because sodium controls the body's fluid balance. Low sodium levels can also happen to people whose kidneys are failing, to people who take diuretics, to professional athletes who drink and sweat a lot, and to people who work out in very hot conditions. So, if you have kidney disease, you should carefully balance how much water you need so that you don't throw off the balance of your important minerals. 8 glasses of water a day? There are now doubts about this wise saying. Different people have different water needs based on their age, size, sex, health, exercise level, and the weather. Most studies have shown that slowly raising the amount of water you drink throughout the day can help people with early-stage kidney disease make more urine, stop stones from coming back, and slow the loss of kidney function. Increasing the amount of water that people with chronic kidney disease drank did not significantly slow the loss of kidney function after 1 year, but it did not have any other negative effects either. If you have end-stage kidney disease, on the other hand, you should limit how much fluid you drink. Remember that many things have water in them. If your doctor tells you to, you should drink more water. But most people shouldn't force themselves to drink water. Your body is getting enough water if your pee is clear. Is water the only drink that's good? The best way to stay hydrated is to drink plain water. But most of us don't want to drink water all the time. Besides that, hot water doesn't taste good, and sometimes there's nothing better than a hot drink. Thank goodness there are healthy drinks besides water. You can change the water too. It's fine to drink sparkling water as long as you pick a brand that doesn't add chlorine or salt. Some nutrients are what you need to keep an eye out for. Stay away from sugary drinks. Also, be careful about how much potassium you eat. Hyperkalemia can happen to people with kidney disease, especially in the later stages. This is when there is too much potassium in the blood because the kidneys can't get rid of it. For your body to work normally, you will always need to eat potassium. However, you should be careful not to get too much potassium. Drinks that are good for people with kidney disease. If you have kidney disease or are at high risk for getting it, here are some drinks you might want to try. Coffee in black. People with kidney problems can drink coffee in small amounts. But because coffee has potassium in it, you shouldn't drink more than 3 cups a day. This is also because it has a lot of caffeine, which can raise your blood pressure. Since high blood pressure is both a sign of and a cause of kidney disease, you should limit how much caffeine you drink. You might be able to always drink decaf coffee or switch between decaf and regular coffee throughout the day. Adding milk or creamers to coffee raises the amount of potassium and calories in it, so drink it black. There is also a lot of sugar in flavored syrups, so stay away from them. But there are some signs that coffee can make kidney function worse in older, overweight people with metabolic syndrome or diabetes. Check with your doctor to see if it is okay for you to drink coffee or tea. 1. Green tea without sugar. Green tea has less energy than coffee and a lot of polyphenols, which are antioxidants. Also, it has less soluble oxalate than black tea, which means there is less chance of getting kidney stones. Most people think that green tea is the best tea for people with kidney disease, but because it has caffeine, you should still drink it in moderation. 2. Smoothies with less sugar. When making smoothies, bananas are often used. However, if your doctor has told you to lower your potassium diet, you should stay away from bananas. But if you only use blueberries and mixed fruit and Greek yogurt as the base, you can make a tasty smoothie that will also fill you up and give you energy. You should make your own drinks so that you can choose what goes into them. You can also use any fruit, vegetable, or seed in smoothies, along with avocados. In the early stages of kidney disease, make sure to limit your intake of sugar, sodium, potassium, and phosphorus. If you have end-stage kidney disease, you should limit your intake even more. 3. Flavored water. Many places now drink infused water to cool off and stay hydrated in the summer. Pick your favorite herbs and fruits and put them in a bowl of water. Let it sit for a few hours. It will taste stronger with fruit or spice the longer you let it sit. It is important to pick foods that don't have a lot of potassium. Lemons, limes, cranberries, blackberries, blueberries, raspberries, strawberries, and citrus fruits, except oranges, which have more calcium, are all good options. You can change it up. On hot days, a lot of people really enjoy flavored water. 4. Juice from cranberries. Our bodies can get hurt by urinary tract infections, UTIs. If you get UTIs easily, eating dried cranberries or drinking cranberry juice can help lower the number of times you get them and keep your kidneys healthy. Also, cranberries are low in calcium and taste great to many people. Apple, grape, beetroot, pineapple, and grapefruit drinks are also low in potassium. But you should talk to your doctor before drinking grapefruit juice because it can interact badly with many medicines, such as statins and medicines for high blood pressure. 5. Ginger ale made at home. It helps your body digest food and keeps your stomach from getting upset. But ginger ale that you buy in stores still has a lot of sugar, even though it has less sugar than other drinks. Most ginger ale recipes call for club soda, which has a lot of potassium. If you need to cut back on potassium, you might want to use seltzer water instead. You can make it with fresh ginger and decide how much sugar to use. Add some lime or lemon juice. What drinks are the worst for people who have kidney issues? What kinds of drinks should you stay away from? People who have problems with their kidneys should be extra careful not to drink certain drinks. These are some. 1. Water from coconuts. People often say that coconut water is a healthy choice to sports drinks, and most people can drink it without any problems. But even in healthy people, it has been shown to raise potassium levels in the urine, so it should only be eaten in small amounts. If your doctor tells you to cut back on potassium, don't drink coconut milk or water. 2. Soda drinks, even light ones. A higher chance of getting chronic kidney disease has been linked to drinking 2 or more carbonated drinks every day. There is a lot of phosphorus in cola and other sodas. Because it has a lot of sugar, you should drink less or not at all. Diet soda is not better for you because it was linked to a higher rate of end-stage kidney disease, and artificial sugars can make your insulin levels worse. 3. Juice from prunes. Also, prunes have a lot of potassium. Having kidney problems and drinking. Surprisingly, if you have kidney disease, you don't have to stay away from booze completely, unless you are taking medicine that says you shouldn't. People with chronic kidney disease can benefit from drinking a little to a lot. You should talk to your doctor about whether you should keep drinking. People with kidney disease shouldn't start drinking alcohol if they haven't already. Drinking alcohol raises the risk of death from a number of different reasons. Also, don't drink too much or too often. If you do drink, red wine is best because it has bioactivators and flavonoids that are good for your kidneys. But drinking too much at once can damage the kidneys quickly and even lead to renal failure in some cases. Like, share, comment, and subscribe to our YouTube channel if you want more content like this. See you in my next powerful, interesting, and informative video.